my name is Amanda and today I will be performing the oral medication skills video for BSN 225. I've gathered all my supplies here. I have my gloves, my 2 cups for the medication, my Tylenol medication cup for the patient and my patient. I will go ahead and make sure I'll check the provider's orders, and also I'll double check in the EHR to make sure everything's correct. And I also make sure I will verify all the 6 rights, which are right patient, right time, right drug, right dose, right route, and right documentation. And then when I enter the door, I will, before I enter there actually, I'll name off all the medications, make sure that everything is, verified and correct and the same in EHR. And I'll go ahead and knock on the door. I let the patient know that I'm their nurse for the day and introduce myself. So knock, knock, knock. Hi, Mr. Smith. My name's Amanda. My name's Amanda. I will be your nurse today. And I'll go ahead and shut the door behind me or curtain for patient privacy. I will go ahead and verify the patient's first and last name and date of birth, as well as check their wrist. All that looks correct. I'm here today to go ahead and give you your medications, and I'll go ahead and explain to the patient, what's going on, and obviously verified myself and verified the patient. I asked them if they have any allergies. They do not have any allergies. And we'll go ahead and perform hand hygiene, which is right here. Go ahead and do that. And then while I put my gloves on, I'll go ahead and let them know that this will take me about 4 or 5 minutes to go ahead and do all the medications, and as well as explain all the medications to the patient, as well as common side effects and adverse side effects. Common side effects are common things that happen often with these medications. Adverse side effects, I need to know if they happen immediately, because those are bigger than common. But first I will start with amoxicillin. Let the patient know that I have amoxicillin for 250 milligrams, and I'll go ahead and let him know that common side effects are nausea and diarrhea, and adverse side effects are wheezing and hives, and please let me know if that happens. I need to know immediately, so I will go ahead and put these in 1 cup here so you can see that. And then next I will go ahead and throw that in the trash, do metformin for 500 milligrams. This helps control blood sugar, and I'm not sure if I mentioned amoxicillin is an antibiotic to the patient, so I'll go ahead and let him know now. So moving to the next medication is metformin. That helps control blood sugar. Common side effects are diarrhea and decreased appetite. Adverse side effects are abdominal pain and shallow breathing. So I'll go ahead and open that up now. Ensure that's okay for him. And I'll go throw that in the trash. And then third, I will go ahead and open up the Benadryl. That is for allergies, any allergy reactions. Common side effects are drowsiness and dizziness. Adverse side effects are urinary retention, and any seizures. So please let me know if any of those happen. And I'll go ahead and open this here and stick that. Oh, my gloves are kind of in the way. There we go. Go ahead and put that right there and throw this in the trash. And then next and lastly is the acetaminophen. It's like a thick liquid syrup. This is the Tylenol. And before I do that, I do assess the patient for a pain score. Ask them, how is their pain? How are they doing? For a scale 1 to 10, rate their pain for me. And common side effects for this acetaminophen is dizziness and nausea. Adverse is jaundice and black tar stool. And I'll ask the patient if they have any questions, And then I've gone all over the 3 medications, and then I'll go ahead and give the patient the cup, and they can decide if they want to take it one by one and give them the liquid, or if they want to take them all at the same time. So I can give them that. Here's the liquid. Great. And then I'll make sure they swallow them, and like I said, provide liquid of their choice, usually water, but if they want, orange juice, cranberry juice, they can do that as well. I'll make sure no problems are happening, everything seems okay. And then for the liquid, I'll go and lay flat on the surface. This is 500 milligrams per 15 milliliters. So I will go ahead and pour out 15 milliliters here. It's on a flat surface. Shake it a little lightly, take the lid off, put the lid up, and then my hand is going to be covering the lid, and that'll prevent the label from having any damage. Let me make sure I can see 15 here. Okay, that's 15. And then got down on eye level, poured it, and then I'll go ahead and use my rag here to clean the top. And then we don't want it to get all goopy. I'll put the lid back on, and then I'm not sure if you can really see it, but it's right at 15 there. Sorry, I don't have somebody recording for me today. And then I'll go ahead and give it to the patient. I already explained the medication to them. Here we go. Great, perfect. And then make sure the patient follows that correctly, everything's okay. And I'll remove my gloves, clean everything up. I'll make sure the patient is comfortable, give him his call light, I'll put him in whatever position he was prior to moving him, and ask him if he needs anything else while I'm here, if he has any other questions. I'll thank him for his time, document the procedure or the medications, and make sure I have the right medications, the right patient, the right dose, and the right time, and then perform hand hygiene again. And that's it. Thank you.